This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Crinone 8% gel is a vaginal gel used for managing female infertility. It helps in providing essential progesterone for a healthy uterine lining. Indications and uses. This vaginal gel is primarily indicated for women experiencing infertility associated with low progesterone levels. It is used to support fertility treatments and regulate menstrual cycles. The gel aids in preparing the uterine lining, which is crucial for successful egg implantation and early pregnancy maintenance. Additionally, it is essential for women undergoing assisted reproductive techniques to enhance their chances of conception. How it works. The gel releases synthetic progesterone into the bloodstream, effectively mimicking the natural hormone essential for reproductive health. Directions for use. Before using, wash your hands thoroughly and use the pre-filled applicator to apply the gel. Lie down comfortably or stand with one foot elevated, gently inserting the applicator into the vagina. Press the plunger slowly to release the gel, and then remove the applicator. Follow your doctor's specific instructions regarding timing and frequency of use for optimal results. Possible side effects. Common side effects may include breast tenderness, abdominal pain, vaginal discharge, and mood swings. If any side effects persist or worsen, seek medical advice. Precautions and warnings. Use with caution if you have a history of liver or kidney disease, heart conditions, diabetes, asthma, or depression. It's contraindicated for breastfeeding women and those with certain medical conditions, including unexplained vaginal bleeding. FAQs. 1. What is Crinone 8% gel used for? It supports fertility treatments and maintains the uterine lining. 2. How is it applied? It's applied vaginally using a pre-filled applicator. 3. What are the side effects? Possible side effects include vaginal irritation and headaches. 4. Can it cause weight gain? Temporary weight increase may occur due to fluid retention. 5. Is it safe during pregnancy? Yes, when prescribed by a healthcare provider. Thank you for watching. If you have any questions or suggestions, please comment below. We appreciate your engagement.